Okay, perfect. So we are online. And yeah, so now let's record our lectures here. That is the goal. Okay, here's what we got to know about zinc. So, zinc is a mineral and it's involved in a bunch of enzyme reactions in our body. And so that includes neurotransmitter stuff, immune regulation, antioxidant defense, as well as gut integrity. So, all of these above. So, it helps us with mood regulation, cognition, neurodevelopment, and brain signaling in with the immune system. So, I was taking zinc personally myself because of testosterone deficiency. And so I didn't have a low zinc deficiency per se, but my testosterone was low. And so I was taking zinc for that reason. And so, but if you do have a deficiency, at least on blood work, that can worsen depression, anxiety, ADHD, and cognitive symptoms. So it's super, super important. So it helps with NMDA receptors, helps GABA, serotonin activity, helps the blood-brain barrier, reduces neuroinflammation, helps BDNF, which is involved with neuroplasticity. Exercise stimulates BDNF. Helps the dopamine metabolism, which affects motivation, focus, and reward. And so, pretty much, it's very, very integral to our body. So, it's important to have this. So, for the most common one, it's plasma zinc. So, this is more of a short term thing, but that's what we commonly measure. And so, this can be influenced by inflammation and fasting, but it can be a little good benchmark. And then serum is also used, but not as valid. And then RBC zinc. So this is one that's a little bit more intricate. So I think a lot of places may not cover it. It's more expensive, but it measures the intracellular store. So that's why it makes it more of a long-term thing. Let me just redo that. Awesome. Welcome in. Welcome. Hope you enjoy. Okay, here's what we got to know about zinc. So it's a trace mineral involved in over 300 enzyme reactions, super important to our body. So it helps support neurotransmitter synthesis, immune regulation, antioxidant defense, and gut integrity as well. So all of the above. So it can help us for neurodevelopment, immune brain signaling, and so it's really important. And if there's a deficiency of it, that can worsen depression, anxiety, ADHD, and cognitive symptoms because it's involved with NMDA receptor signaling, which is involved with glutamate, involved with GABA, serotonin, blood-brain barrier, BDNF, brain-derived neurotrophic factor. It helps dopamine metabolism and promotes immune resilience, gut integrity, wound healing. So many important areas that zinc is involved in. I've taken it personally in the past too for testosterone support. So pretty much there's the serum plasma zinc, that's the most common, and then there's also the RBC zinc, which is less commonly done, but this reflects more of the intracellular stores. So it's a better longer term measure, just like RBC, magnesium, or HbA1c. So for plasma and serum zinc, the levels are 60 to 130 that we would look at. Functional, at least we want to get above 90 for RBC zinc, so it's about 8.5 to 14.5, and the functional target should be greater than 12. Basically, we don't want zinc overload, but we do want to make sure there's a good amount of zinc there. People who have less than 70 zinc, they often might have symptoms linked to fatigue, mood issues, immune weaknesses. And if their zinc is less than 60, then there's likely a deficiency with there, and that's where supplements are needed. So if there's a low zinc and a high copper, this can be imbalanced as well. So it can be seen in ADHD, depression, and chronic inflammation. So you want the zinc to copper ratio to be 8 to 1 to 12 to 1. So that's why sometimes, because their absorptions are very similar. So sometimes they'll say don't supplement copper without supplementing zinc because you can throw off that ratio. So if people who are picky eaters, vegetarians, GI issues, alcohol or stress, all of these are risk groups for zinc. And I know this because for me, when I was trying to increase my testosterone levels, I knew that I had to eat a lot more red meat and focus on the red meat so that I could increase my testosterone. So, in terms of its psychiatric relevance, so there's various different disorders that it's associated with. So, for depression, if you have low zinc, this will reduce your serotonin and your BDNF, and it also will worsen your antidepressant response as well. So, super key for that. For anxiety, it helps GABA, it helps glutamate, and if there's a deficiency, that will lead to hyperexcitability. Because if you modulate GABA, which is calming, and if you modulate glutamate, which is also calming, let's say you have a GABA deficiency, so now you're going to be too excited, and that'll throw you off. ADHD, so low zinc has been tied to hyperactivity, impulsivity, and poor focus. So that's why for a lot of kids, increase helping their diet is one of the best treatments for ADHD, especially a more of a protein-based diet, because that helps you get more zinc. Autism spectrum, so zinc deficiency is common due to dietary and gut absorption issues. Cognitive decline, so zinc's helpful in memory, attention, and neuroprotection, and for EDs as well too. So there's a role with appetite regulation and emotional resilience. So all of the above, super important. So to supplement, so to supplement, you need about 15 to 30 milligrams of elemental zinc every day. That's pretty good. Most of the supplements come in 15 milligrams. If there's a big deficiency or you're trying to go super therapeutic, then you might need 30 to 50. For example, I was taking 30 milligrams for a little bit as I was trying to increase my testosterone. Long term, you don't want to exceed 40 milligrams without monitoring the copper, because you want to be able to do the both together. Because you want to make sure that the ratio is good. So there's different forms of zinc that come in. So zinc picolinate, so highly absorbable, it's great for mental health. Citrate, well absorbed, gentle on the stomach. Gluconate's very common, you might see it in the over-the-counter option. And then the carnosine one used for gut lining. So probably one of these two is probably what you're gonna be going with. For me, whenever I see it's a common some of the common options, I tend to be a little bit more hesitant about it. But there's many different forms, and yeah, they will all work. So you want to take it with food, and that's really helpful to reduce some nausea. Some people do get stomach nausea with it. Avoid it with iron, calcium, or high phytate foods like grains and legumes. That can impact the absorption of it, because your body can only absorb so much of that kind of stuff at one time. So monitor your copper levels if you're going greater than 30 milligrams per day. And so account for the multivitamin zinc content too, because a lot of multivitamins will have zinc. So for labs, follow-up labs, you want to obviously check the zinc, the plasma or serum zinc. You can check the RBC as well. Checking out copper and ceruloplasmin just to check out for that balance. So then you can monitor zinc to copper ratio. Alkaline phosphatase, so low level, could be indicative of a zinc deficiency as well, so it could cue you to look for that. And then CRP or ESR, so if there's a lot of inflammation, that can lower the serum zinc artificially as well too. So overall, zinc, very common in psych patients, very overlooked. Even a moderate deficiency can worsen energy, sleep, attention, and immune function. Works well with magnesium, B6, omega-3s, and vitamin D, so all of the above. So it supports neurotransmitter balance and reduces neuroinflammation as well. And so you just want to be rechecking the labs, make sure your supplementation's good, and watch out for that copper imbalance too. But yeah, that's to know about zinc labs and doing that. Yeah, if you want to check out my website, that's the best place to see about my consultation stuff. Are intrusive thoughts hard to deal with? They can be. Yeah, it just depends. It depends on how well you're addressing them, how often you're changing the thoughts, how much you believe those thoughts, etc., etc. EUPD and BPD are the same thing? Yeah, they're the same thing. We use BPD in America, happy 4th, but different countries, I think that Europe uses EUPD. Same thing. Genetic testing, yeah, I do it if patients have failed some meds. I don't do it all the time, but if they've failed a couple things, that's when I think it's most helpful. Okay, here's what we got to know about copper. So copper is a mineral that's used in brain development, neurotransmitter balance, energy production, and iron metabolism. So it's necessary for health, but it's harmful if you have too much of it. It leads to, for example, like Wilson's disease in psychiatry. So copper imbalances. So you can have emotional dysregulation, anxiety, depression, and irritability. So that's where checking for copper can be really helpful, and it correlates with zinc too. So for its functions, so it's required for dopamine beta hydroxylase. This helps convert dopamine to norepinephrine. So it's very important to have copper in the body. So this is the interaction that's used, and then the copper, it will donate an electron to dopamine beta hydroxylase to become norepinephrine. And so it involves antioxidant enzymes like superoxide dismutase. So antioxidants are very good. They clean up free radicals, help decrease inflammation in the body. So involved with iron metabolism. So that obviously you need that, otherwise you have microcytic anemia. Helps connective tissue, immune defense, energy production. And so high copper will increase norepinephrine, glutamate, and oxidative stress, which can worsen psychiatric symptoms. So for copper, the normal levels are 70 to 140, but then the functional target's a little bit more narrow. Ceruloplasmin, so that's the storage of copper, so that's 20 to 35. And then copper to ceruloplasmin ratio, you're just trying to get it less than 1. You don't want too much ceruloplasmin. And then zinc to copper, you want 8 to 1 or 12 to 1. So because you don't want too much copper here. For the interpretation of it, so it's often seen in anxiety, panic, mood swings, PMS, or autism. If you have low copper, that can cause fatigue, low immunity, neuropathy, and anemia. So really important to see that. If you have too much copper but you don't have enough zinc, then that's very common with psych disorders, neurodevelopmental disorders, especially the neurodevelopmental disorders. They have a lot of nutrient deficiencies that are kicking around. If you have a ton of copper and you have normal ceruloplasmin, you can really have a copper overload. If you have a ton of ceruloplasmin with high copper, then you could have an inflammatory or an estrogen-driven response. change it. Yeah, magnesium glycinate is good for anxiety. Supplements for focus, L-theanine's good, or L-tyrosine. Avalide is decent as well too. It's Wellbutrin plus dextromethorphan. It's really good for low energy. I'm just gonna restart. Okay, here's what we need to know about copper. So this is a mineral that's involved in brain development, neurotransmitter balance, energy production, and iron metabolism. So all of this stuff. So it's got a double role. So it's necessary for health, but it's harmful if you have too much of it. So in psychiatry, we use copper imbalances, so especially like elevated copper, because that can contribute to emotional dysregulation, anxiety, depression, irritability. So that's something we especially want to track. Copper is important for us because it's involved with converting dopamine to norepinephrine. So basically, dopamine beta hydroxylase gets an electron from copper, and it helps it make norepinephrine. So it is needed. It helps antioxidant enzymes like superoxide dismutase. So very important over here too. Basically helps get rid of the reactive oxygen species and clears that up. Helps us with connective tissue, immune defense, energy production, so all of that. And so if you have too much copper, this will increase norepinephrine, glutamate, and oxidative stress too. And so all that will worsen your psych symptoms. So for copper testing, we do serum copper, so that's most commonly done. That's the circulating copper. And then ceruloplasmin, this helps bind the copper in the blood. So that's why we test both of them. Because we want to assess that, okay, there shouldn't be too much free copper because we want it to be tied up, but obviously you don't want too much tied up either. So copper to ceruloplasmin ratio, this just tells us, that gives us an insight of the free unbound copper, which is neuroactive and potentially toxic, right? So if you have too much, that's when a problem happens. And so sometimes they'll do RBC copper or 24-hour urine copper as well too. But by far and large, these two are the big ones that are done. So for its normal and functional ranges, so 70 to 140 is the general range, with the functional being more narrow. The ceruloplasmin, so 20 to 35. And basically, Are you putting this info in the resource page? Yes, so this stuff is for my labs, so for our labs module. And yeah, so basically, yeah, I just had some food, so my mind's kind of like slow. But basically, this is for our lab module page for our program. So I'm adding in a new section on how to interpret different lab results. So if you check that out, I've already added in 12 so far, and then now I'm going through some of the more rare ones like copper, zinc, and then going to be doing some infectious testing stuff as well too. So that, excuse me. So that's what I'm adding in. Yeah, and so this is for our NP coaching program. That's what I'm adding in. Jill says, can you be bipolar and have ADHD? Yeah, you can have both. Do you section people? No, I do not. Can you take ashwagandha and L-theanine with supplements? Yeah, with antidepressants. Yeah, you can. Is missing antidepressants bad? Yeah, you don't want to miss doses. That's not good. That is not Gucci. And then Lorraine, yes, I'm putting that in the resource page. Accurate. Yeah, for the PMHNP coaching, all of this is in my bio as well, or you can send me a message, either or. Oh, here's an interesting one. Foods. Okay, so here we're going to talk about food sensitivity testing, so these IgG panels. So food sensitivity testing, this measures delayed immune reactions, like hours to days later, to specific foods based on IgG antibodies. So unlike the IgE food allergies, so that's more the immediate reactions, IgG is a delayed hypersensitivity. And so that can present as mood changes, GI issues, fatigue, or skin problems. So they'll pretty much just test IgG 1 to 4 to 90 to 200 different foods, including dairy, wheat, eggs, nuts, meats, fruits, and veggies. So there's like a standard one, a panel that they do. If you take it to LabCorp and things, then there's more detailed panels that do too, which are the more 90 to 200 foods. So basically the whole idea is that if you get exposure to antigens, you're constantly triggering an immune activation, and so that's going to lead to systemic inflammation, and then that inflammation is going to cause damage in the gut, leading to leaky gut, and then leading to brain symptoms. So for some people, eliminating high IgG foods can help them with brain fog, fatigue, GI symptoms, eczema, migraines, and mood lability too. So the IgG, like, they're not perfect by any means, so sometimes they reflect exposure rather than a harmful reactivity. So interpreting requires a clinical correlation. Like, these aren't infallible results by any means. Does insurance cover it? It depends. Insurance may cover the IgG panels. It'll cover it if you code for the right thing. So I'll usually put in a code like GI gastric distress. Which, like, Many people have nausea, and that's a code. So, for example, this is a patient that I had who we did the food specific IgG allergy panel with, and so for him, he tested positive for all of this stuff, and I asked him, he's like, yeah, I eat this stuff, and I don't really notice any effects from it. So, the way that I interpreted this was that he's just very inflammatory all around. His CRP was high. I think he's got long COVID as well. So that's the way that I interpreted it. So it's a decent thing to test for, but you have to interpret it with clinical correlation. So in psych, we use it for food-related triggers if they're brain fog, fatigue, low energy, depression, anxiety that's not getting better, ADHD, neurodevelopmental disorders, autoimmune, chronic inflammatory states, and then chronic GI complaints like bloating, IBS, which co-occur with psych symptoms. So many allergists and conventional organizations, they don't support the IgD testing. So it's more of like a fringe type of thing. It's not something that's mandatory by any means. For a lot of people, it could just be related to regular consumption. It doesn't mean that they have a sensitivity to it. So false positives, as I mentioned, are common. But anecdotally, there's some thought behind it, and then some preliminary studies that support it as well, too. So I'd like to get it data, especially if I have a patient more functionally minded and they're very interested in diet, holistic stuff. But it's not something that I'll think about for the every patient. So if you want to try to interpret it functionally, so IgG4, so this is about 30 to 50 micrograms per milliliter. Thanks for the knowledge. Of course. Damn, I started recording, but I started speaking, but I stopped. I didn't hit the record, so I forgot. So I was just yapping without hitting record again. Oh yeah, I would recommend gut, especially if you have constipation or diarrhea. Gut health testing is super important, so definitely recommend it. Ooh, I think my phone is dying. Hold on.